everybody. My name is Dr. Roney. This is Liliana. We are here to talk about IBS. So IBS stands for Irritable Bowel Syndrome. And probably at one time or another, we probably all had it to a degree, right? So we want to talk about what is it, what's happening in your digestive system, what's causing it is probably the main thing that we'll talk about. And then Liliana, who's the nutritionist here, will talk to you about what foods you really want to try to avoid when we're dealing with IBS. So let's think of it this way. When there is irritable bowel, you have inflammation in your digestive system, right? Your digestive tract. That's the number one. So that it's inflamed. And when it's inflamed, one of the number one signs or symptoms is diarrhea. You're going to have loose bowels. But you could have cramping, you could have bloating and gas and constipation. Well, really not constipation.
It can go back and forth with the IBS, right?
It can, yeah, it can. I see a lot of the more loose, but it can definitely go both ways with constipation and diarrhea. But nonetheless, you'll definitely know something's not right. You'll know something's not right with your gut. So let's talk in terms of, from a cause standpoint, what would cause that? Well, number one, what you eat can definitely contribute to IBS, right? And Liliana will get into this, but the biggies that we see are gluten for sure. Even if you're not celiac disease, that's one that you'll probably touch on. But dairy can do it. Soy-based products that are unfermented, processed, I'll call them soy, your corns, your peanuts. There's really a top 10 list, but in general, there's this paleo type of concept where if you're on a deserted island, what could you eat? You could eat whatever the island offers you in its most natural
form. You can pick and
pick or chase, right? Yeah, kind of a pick or chase mentality, which eliminates grains and some of those other things, which again, Liliana will talk about. So foods definitely play a big factor in irritable bowel. But then what about the inability of the stomach to start breaking down foods properly, right? If I don't have enough digestive enzymes, if I don't have enough hydrochloric acid, what's going to happen is those foods will be left in really an undigestible form when it gets into the small intestine. So the immune system reacts to those undigested foods versus if they're well digested, like a protein getting into simple amino acid form, very easy for the body to digest that, to assimilate into the cell. But if it's clumped together, multiple strands of amino acids together because it's not broken down properly as a protein, as an example, the immune system will attack that. Yeah. And you'll get inflammation as a result. So your ability to break down those foods become very important as well. That's why the enzymes and the hydrochloric acid, as we get older, are a major factor. Number three, there's a term called dysbiosis, where we don't have enough good bacteria versus the bad bacteria. And to keep it simple, the bad start to outweigh the good. That's going to create, it's going to set up your digestive system for having problems in a numerous different ways. But it's going to add to the irritable bowel for sure.
Yes, definitely.
Your fourth R in that 5 R's protocol is going to be repair the gut wall. So leaky gut is a big part of this. To keep it simple, if I have food going into my small intestine, it should permeate through the slits. They call them tight junctions. And then it feeds the cell. But what will happen is these tight junctions start to widen, and they'll widen because of stress and inflammation and infections and so forth. But when they widen, now everything from toxins to pathogens to undigested foods start to permeate through, and then the immune system looks at those as foreign and they attack. So more inflammation ensues. So leaky gut is also a big part of that irritable bowel. Perhaps one of the most important things that I think happens is we get infections in the gut. So we could have, parasite infections. We could have candida or yeast overgrowth. We could have SIBO. We could have, the bacteria, E. coli. There's numerous different infections that could occur within your gut that will cause inflammation in the lining of that digestive system, especially the colon, that leads to irritable bowel.
Right.
So to keep it simple, we go through that 5 R's protocol. We remove the foods, we replace the enzymes and hydrochloric acid, we revive the microbiome, we repair the gut wall, and really, again, in all of that, one of the most important is removing infections if they're there. So there's testing that we do here at the clinic. I'll send a lot of patients to Molly.
Mm-hmm.
Molly does biomeridian or bioimmune testing that can find candida and parasites. We could do stool ecologies that test for all of these things, right? And so we want to, if there is irritable bowel, one of the first things I personally do, I want to find out if there's infections in there.
Mm-hmm.
And then we'll start working on, if they're there, that's one of the top things we'll work on, because if they are there, then those other 4 R's are kind of, they're not irrelevant, but they're only Band-Aids. And so we want to address them. We want to have good enzymes and probiotics and repair the leaky gut, but we can't do that if there's infections, because the infections just keep driving the inflammation and the breakdown of the gut. Hopefully that makes some sense,
Yeah,
right?
absolutely.
Yeah, so getting infections out of there by identifying them is probably goal number 1. Once we do that, and there's very specific protocols for that, then we start working on building up the gut. Now, having said that, that's kind of the standard of what we see. But there's also patients that come in with heavy antibiotic use, right? That have killed their good bacteria in their gut. That makes them more susceptible to infections and then irritable bowel. They could be taking NSAIDs, right? Your non-steroidal anti-inflammatories like your aspirins or your Advils, ibuprofens, things like that, that could tear up your gut and then cause the irritability or the irritations in the gut lining, leading to irritable bowel. So without question, there's a lot to it. However, that gives you a general idea that if you do have, diarrhea, you do have, loose stools, bloating, gas, irritability, things like that, you probably have IBS. But now at least you have an idea, okay, it's not just something that I have and I have to live with, that there's causes to it. All we have to do is go through that 5 R's protocol, starting with eliminating the infections if they're there, and then work backwards and start addressing foods and start addressing, which we do right away, addressing enzymes, addressing probiotics, and start working on that leaky gut. A lot to all that, but that at least gives you an idea of why you may have it and what the causes might be. So I'll turn it over to Liliana, because she'll talk about the first R, which is removing the foods. And sometimes that's the first place to start too, quite honestly. So go ahead.
And so, one thing that's generally missed, and I always, the food is super important, but stress.
Yeah.
Okay. I would say most of all my irritable bowel syndrome patients or leaky gut patients have an overwhelming amount of stress. Now, you might even have the experience when you have to get up to go speak and you're really nervous about speaking. What's the first thing you have to do? You run to the bathroom, right? It creates peristaltic activity. So this low level cortisol that we are under, because we do too much in a day. I've lived in 4 different countries, and nobody is at the speedy level expectation that we have in the United States, especially in California. And so we're all under this low level of cortisol, which is a stimulant. And what does the cortisol do? It prepares you to run, flee, and fight. So what's it going to do? It's going to stop the digestive system to take the energy out to the hands and the feet. This is why I'm very emphatic about when people eat, they need to eat in a relaxed manner, not in their car or the computer or at their desk, because they're already thwarting digestion. So the first thing that I do with patients is really talk to them about how their reaction is to the outside world and how we can start to, rather than internalizing it, really choose what I want to let in as far as things that I can do things about. What I can't do about, why am I putting my attention on it? First thing I can do. Second thing, after I evaluate their food, diary of what they are eating, then very quickly I can kind of ascertain some of the foods that may be also causal effect in the inflammatory cascade, because everybody has a blueprint of what they do best with. Now, we call that, blood typing foods for their blood type. Now, it's not, what you would consider standard American kind of traditional way. Your medical doctor's not going to ever talk to you about. This is more, what we would consider alternative methods of looking outside the box. And so the first thing I do is ask what their blood type is. And so then I let them know what their propensity is in food sensitivities. So my goal is to get the food sensitivities out that are very basic. We may have to do an allergy test of food sensitivities as well, which is just another layer, but we kind of go for the things that we can do without spending a whole lot of money.
Yeah.
Once we remove that, I always find patients coming back saying, I don't have the bloating, I don't have the gas, I don't have my diarrhea, and I feel so much better. Mental, fog is gone. Right away, if they do have the, 4 or 5, 6, 7 bowel movements a day, we want to stop that right away. So I love charcoal for that reason. I say have 3 charcoal pills, coconut charcoal, twice a day to bind it, to do also a really good fiber. But, again, like we were talking earlier, Dr. Roney had mentioned, sometimes constipation goes along with irritable bowel. So if you've got loose stools, then the fiber will go great. Right? And so if you have constipation, it just might blow you up because you don't have enough friendly bacteria in the gut. And so you need to make sure that, one, I'm eating foods that like me, that can digest well. In my stool, do I look at food that's undigested? Well, again, Dr. Roney was talking about digestive enzymes, but there's a method. If we just start adding all the little band-aids of what we think you're missing, but we haven't addressed the inflammatory aspects of parasites or candida or SIBO, then again, we're not really addressing the root cause. So everybody's an individual, but first we kind of look at the real basic, let's kind of identify what kind of lifestyle you have, what kind of foods you have in your diet. Let's educate you on that. And let's do some cleansing. Cleansing is imperative. And so again, we have many methods that we can work on the GI system and healing the GI. As Dr. Roney says, some of the tests we have are very specific about what is missing or what is too much that we need. Because sometimes you might have too much of a healthy bacteria that's way too much because you've been taking the same probiotic for a year. And so again, we don't take the same thing over and over again. I say every 3 months, don't you kind of want to recheck, because you have new blood every 3 months and you may be saturated already. And so oftentimes people have irritable bowel syndrome, they can't do a lot of raw foods and they get really bloated and gassy. So during the period where they're actually having an episode, I have them do more cooked foods and soups and crock pot things so that it's more healing, more soothing. A lot of bone broth would be great. I love aloe vera juice first thing in the morning, 2 tablespoons twice a day. We have an incredible product called Ion Biome, which is fantastic. It's got all of these humic minerals in it. It also has like dirt bacteria in there as well. So it really is healing. And so again, what we want to do is at the same time that we remove these things, begin to heal the lining of the gut, so that we can,
and calm that inflammation
down.
That's
in fact, we even have really great protein powders that are very specific for getting the fire down off in the gut, before we go to different types of different protein shakes as well. So main thing is the body hates the same thing over and over again. So if you eat eggs every single day, the likelihood of you being allergenic to it in a couple of weeks is probably high. There are certain things that we know, like Dr. Roney said, peanut, for example, has got a lot of fungus on it, a lot of aspergillus in it. He mentioned about grains. Well, it's not so much the staff of life that we read about in the Bible, because that, in its basic God-formed nature, didn't even have the amount of chromosomes that our grains have now because of the genetic modification. But the real problem is after we harvest them, to reduce the mold, we spray, Roundup on them, which is glyphosates, and that really tears anybody's gut up. So bottom line is we're seeing so much gut issues, more than we ever have, because of the excessive amount of stress we're experiencing, the excessive amount of environmental toxins, the xenoestrogens, all the synthetic, packaged food things. So we really have to get back down to nature. Like what Dr. Roney says, if you can't pick it, catch it, chase it, right, then you probably shouldn't be eating it, right? But it takes a little bit of work when you have to get in the kitchen and cook these things. But you know what? You are totally worth that time that it takes for you to heal your gut. So hopefully we've given you some really good tips today. Dr. Roney, do you have anything else to add to that?
No, a little insight. I think it's great. I think, you went back to a couple things. Stress, right? Your sympathetic nervous system is your fight or flight. Your parasympathetic is your rest and digest. So when you're in stress, it overrides your rest and digest nervous system. So then you're going to be on hyper excitability in that nervous system.
Very nervous stomach.
And then, exactly, which can also lead to that irritable bowel. It was a good point. I didn't mention that. But yeah, look, these videos are kind of intros, right? We just want to make sure that if you have things like this, that there's answers. I think that's the biggest thing. and you go through the foods, you go through the, like we said, the replace, repair, revive, and remove the infections. And typically we'll be able to fix or heal that irritable bowel for sure.
Yeah.
It's sometimes a little detective work too.
Yeah.
But if we follow the formula, follow the checklist, we can get to the other side.
And a lot of patience on your side.
That's right. That's right. Yeah. Patience is a big thing with an IENCE, right? Patience. Okay, gang.
Okay.
All right. Yeah. If you need anything, just let us know. We're here to help you, whatever that might be. Okay. Enjoy. Have a great day.